How the immune microenvironment impacts cancer progression and therapy. The role of myeloid cells and monocyte developmental trajectories. Overview of cancer and the immune system. Cancer is not just a disease of cells, it's a battle between the body's immune system and abnormal cells. While the immune system is designed to fight off invaders, in cancer, the immune microenvironment can be both a weapon and a shield for tumors. Today, we're diving deep into how the immune microenvironment influences cancer progression and therapy, with a special focus on the myeloid compartment and the developmental trajectories of monocytes. Segment 1. Understanding the immune microenvironment. The immune microenvironment refers to the cellular and molecular landscape surrounding a tumor. It's made up of immune cells, blood vessels, signaling molecules, and other components that play a crucial role in whether the immune system can fight the tumor or support its growth. 1. Components of the immune microenvironment. Immune cells, T cells, B cells, macrophages, dendritic cells, and myeloid cells. Stromal cells, fibroblasts and endothelial cells. Tumor-associated molecules, cytokines, chemokines, and growth factors. 2. Role in cancer progression. Tumors can manipulate the immune microenvironment to promote their own survival, growth, and spread. Some immune cells, such as regulatory T cells, TREGs, can suppress immune responses and aid tumor growth. Segment 2. The myeloid compartment. A double-edged sword. The myeloid compartment is a crucial player in the immune microenvironment. It includes a variety of cells, most notably monocytes, macrophages, and dendritic cells. While these cells have protective roles, in the context of cancer, they can often be hijacked by tumors to promote disease progression. 1. Myeloid cells and tumor progression. Macrophages. These cells can either attack tumors or support their growth. Tumor-associated macrophages, TAMs, are often found in tumors and can be polarized into either M1, pro-inflammatory, tumor-suppressing, or M2, anti-inflammatory, tumor-promoting, phenotypes. Monocytes. These are precursors to macrophages and dendritic cells. When they infiltrate tumors, they can differentiate into TAMs and influence the tumor microenvironment, TME. Dendritic cells play a role in antigen presentation and immune activation. However, tumors can reprogram these cells to become immunosuppressive. 2. Immune evasion via myeloid cells. Tumors can attract myeloid cells that promote angiogenesis, new blood vessel formation, immune suppression, and extracellular matrix remodeling, all of which facilitate tumor growth and metastasis. Macrophages in the TME often produce TGF-beta, IL-10, and VEGF, molecules that suppress immune function and promote tumor cell survival. Segment 3. Monocyte developmental trajectories. From precursors to tumor-promoting cells. Now, let's zoom in on a key player in the myeloid compartment, monocytes. Monocytes originate in the bone marrow and circulate in the blood until they are recruited to sites of inflammation or tumors. However, their developmental trajectory isn't set in stone. Depending on the signals they receive, monocytes can differentiate into different types of macrophages or dendritic cells, each with distinct roles in cancer. 1. Monocyte subtypes and differentiation. Classical monocytes, CD14 plus CD16-. These are the most abundant monocytes in circulation, and they are typically recruited to sites of injury or infection. In cancer, they can differentiate into pro-inflammatory or tumor-suppressive macrophages. Non-classical monocytes, CD14-CD16+. These monocytes are involved in tissue remodeling and have been shown to promote tumor progression by supporting tumor vascularization and immune evasion. 2. Monocyte recruitment to the tumor microenvironment. Tumors release signaling molecules like CCL2 that attract monocytes from the bloodstream. Once at the tumor site, they differentiate into macrophages or dendritic cells that either fight or support the tumor, depending on their activation signals. The tumor microenvironment, TME, can skew this differentiation toward a pro-tumorigenic phenotype, where monocytes contribute to immune suppression, angiogenesis, and metastasis. Interestingly, the developmental trajectory of monocytes can be influenced by the local environment. Tumor-derived factors can push monocytes toward an M2-like macrophage phenotype that suppresses anti-tumor immunity and accelerates tumor progression. Segment 4. How the myeloid compartment affects cancer therapy. Understanding the role of myeloid cells in cancer progression is key to improving cancer treatments. Myeloid cells, particularly macrophages and monocytes, can influence how tumors respond to therapy. 1. Impact of myeloid cells on chemotherapy and radiotherapy. Chemotherapy. Myeloid cells can contribute to the resistance of tumors to chemotherapy. TAMs can enhance tumor cell survival and mediate drug resistance by secreting anti-apoptotic molecules like IL-10 and TGF-beta. Radiotherapy. Similar to chemotherapy, radiotherapy can alter the TME, causing macrophages to switch from a tumor-suppressive to a tumor-promoting role. This switch can make tumors more resistant to treatment. 2. Immunotherapy and myeloid cells. Checkpoint inhibitors. Drugs like PD-1, PD-L1 inhibitors are designed to reactivate T cells, but myeloid cells in the TME can blunt this effect by suppressing T cell activity. Macrophage depletion strategies. Emerging therapies aim to target tumor-associated macrophages, TAMs, to improve the effectiveness of immunotherapy. By depleting or reprogramming TAMs, it may be possible to enhance the anti-tumor immune response. Monocyte-based therapies. Clinical trials are exploring strategies to either repolarize M2 macrophages to an M1 phenotype or boost monocyte-derived dendritic cells for more effective antigen presentation. Segment 5. Targeting the myeloid compartment. Future directions in cancer therapy. With an understanding of how myeloid cells contribute to cancer progression, researchers are now looking for innovative ways to target these cells to improve cancer treatment outcomes. 1. Reprogramming myeloid cells. Scientists are working on therapies that can reprogram macrophages from a pro-tumorigenic M2 phenotype to a pro-inflammatory M1 phenotype. Immunomodulatory agents that target the myeloid compartment, like CSF1R inhibitors, are being tested in clinical trials. 2. Monocyte reprogramming for immunotherapy. By understanding the signaling pathways that govern monocyte differentiation, researchers hope to create therapies that can reprogram these cells to present tumor antigens more effectively and activate a robust anti-tumor immune response. 3. Personalized therapies. Single-cell RNA sequencing and other technologies allow researchers to analyze the myeloid compartment in individual patients, leading to more personalized and effective treatments based on the patient's specific TME. Conclusion. The future of cancer therapy. The myeloid compartment plays a critical role in cancer progression and therapy resistance. By targeting myeloid cells and understanding their developmental trajectories, we are unlocking new opportunities for more effective cancer treatments. The future of cancer therapy lies not only in targeting cancer cells but also in manipulating the immune microenvironment to make it more hostile to tumors. As research continues to evolve, we are one step closer to turning the tide against cancer. If you found this video insightful, don't forget to like, subscribe, and share it. Drop your thoughts or questions in the comments below, and stay tuned for more in-depth looks into cancer research and treatment innovations.